Total knee replacement surgery has become the standard for individuals with chronic knee pain and injuries. However, not all knee conditions require a knee replacement surgery. This video will help you understand when a total knee replacement is necessary. Hi, my name is Jade and I'm a physical therapist at EW Motion Therapy. Today we'll be discussing when knee replacement surgery is not necessary, the risk factors involved with needing a knee replacement, and some non-surgical treatment options. So while knee replacement surgeries are incredible for anyone who's been dealing with chronic and debilitating pain, whether from an injury or just chronic wear and tear, it's not necessarily the best for every person. So we want to go over some of the reasons why you might not need one, but ultimately you and your physician should consult together to see if this is the best option for you, because there might be less invasive options that could carry you further in life. So let's talk about a few conditions that may not necessarily require a total knee replacement surgery. The first one would be ligament tears, ACL, PCL. Those things, while are important and do have their own surgeries, may not require the entire joint to be replaced. The second one would be mild to moderate osteoarthritis. And while severe arthritis is definitely a reason for a total knee replacement, prior to the severity of it, we can strengthen around the joint. We can make sure that you can heal and maintain that pain prior to replacing the joint. And lastly, a partial knee replacement is also an option. This is where only part of the joint is really damaged and needs to be replaced rather than the entire joint itself. So now let's talk about the risk factors that could increase your likelihood of needing a knee replacement down the road. There are multiple different factors that could result in a knee replacement, but some of the most common are age and obesity. Over the years, wear and tear happens on the joints, and excess weight on the body leads to degenerative changes on the joint and other muscles of the body itself. Some other risk factors include genetic predisposition, previous injuries to the knee, as well as different types of arthritis. But just because you have these risk factors does not necessarily mean that you're going to need a knee replacement down the road. It just simply increases the likelihood of that chance. Before considering a total knee replacement surgery, it's super important to talk about all the options with your doctor, as there might be a non-invasive option that is better for you. And there are multiple different options. This includes medications, different modalities such as TENS, heat and cold therapy, along with other weight management and lifestyle changes. But one of the biggest non-operative treatments is going to be physical therapy, and let me explain why. We can do so many things to help your pain, to help your joints, to recover prior to needing any type of surgical intervention. And this includes strength training, where we build up the muscles around the hips and around the knees themselves, making them stronger and more stable, which then reduces your pain. We have functional training, which kind of focuses more on your daily skills, things that you need to do in life, such as squat or climb up stairs. These things we take you through, work on your body mechanics, making sure that you're not only doing them right, but doing them well to prevent that pain. Some other things that we do are pain management, which includes manual therapy, like soft tissue mobilizations, massage, myofascial releases, and all these things are super important when it comes to healing and recovery. And lastly, we have our range of motion exercises. For the knee joint, it is crucial that we keep proper range of motion, not only just for the health of the joint itself, but for your functional movements later on in life. So as a physical therapist, we take your body through those ranges and help you to gain as much as you possibly can. Total knee replacements are valuable for individuals who have suffered from severe and chronic knee injuries over time and have not responded well to non-operative treatments. However, trying conservative options first, such as physical therapy, is absolutely crucial. Click the link in our description below to watch our video, What is Physical Therapy?, to learn more about the treatment methods and how it can benefit you.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.